Hello and welcome to my channel. In this video we will discuss about hemorrhoids and you can say piles. So basically in this video we will discuss about what are the top 7 homeopathic medicines which has been successfully used for the treatment of hemorrhoids or piles. Now what are the basic topics that we will cover in this video? So as you can see here on the screen we have provided a picture of the topics that we will cover in this video. First of all, we'll talk about what exactly is the meaning of hemorrhoids or piles. The next we'll talk about the different grades of internal piles according to the severity. The next we'll talk about the clinical features, that is what are the signs and symptoms of hemorrhoids. And next we will talk about the etiology, that is what are the causes and the risk factors which are responsible for piles. And next very important part of this video, that is treatment. So basically here we will talk about the homeopathic treatment, homeopathic medicines for the treatment of piles or you can say hemorrhoids. And at last we will talk about the lifestyle changes which are very essential to manage piles. So these are the basic topics that we will cover in this video. So let's start. So first of all, we'll talk about what exactly is the meaning of hemorrhoids or you can say piles. So the term piles or the hemorrhoids refers to a condition in which the veins around the anus or your lower rectum are swollen. Hemorrhoids can either be internal or external. If we talk about the internal hemorrhoids, so internal hemorrhoids develop within the anus or the rectum, and external hemorrhoids develop outside of the anus. So this is the exact meaning of hemorrhoids or pile. Now next we'll talk about the different grades of internal piles according to the severity. So as you can see here on the screen, we have provided the pictures of the different grades of the piles, internal piles according to the severity. So let's talk about it. So internal piles can be classified into grades according to their severity. So as you can see here on the screen, grade 1 piles. So grade 1 piles is marked by small inflammations that are usually found inside the lining of the anus and are not visible. Grade 2. Grade 2 pile is characterized by larger hemorrhoids than the grade 1 piles, but they too remain inside the anus. These protrude outside the anus while passing stool and go back into the rectum after defecation. Now grade hemorrhoids protrude during defecation and need to be manually pushed back inside the anus. And last grade, that is grade 4 piles. This is a very severe case. This cannot be pushed back inside and need immediate medical attention. So these are the different grades of internal piles according to their severity. Now next we'll talk about the clinical symptoms of hemorrhoids or you can say piles. So let's talk about the clinical features, that is what are the symptoms. So symptoms depends on the type of hemorrhoids you have. So if you have internal hemorrhoids, so the symptom can be blood on the tissue after having a bowel movement, skin that stick out of anus during bowel movement. And if you have external hemorrhoids, then symptoms include extreme itching around the anus and uncomfortable lumps or swelling near your anus, ache or pain around the anus, especially when sitting. These are the clinical features of internal and external hemorrhoids or you can say piles. Now next we'll talk about what are the causes, that is what are the etiologies and what are the risk factors that are responsible for this hemorrhoids or you can say piles. So let's talk about the causes and the risk factor. So hemorrhoids occur when there is too much pressure on the veins around the anus. So possible causes and the risk factors include: first, straining during a bowel movement, sitting for a longer period of time, especially on the toilet. Next, having chronic constipation or diarrhea. Next, having a family history of hemorrhoids. Engaging in consistent heavy lifting or other activities that strain your body. Next, having obesity. having anal sexual intercourses, which can irritate hemorrhoids or piles. Next, being pregnant. So an enlarged uterus presses on the vein in the colon, causes it to bulge. Next, being over the age of 50. So these are some causes and the risk factors which are responsible for hemorrhoids, or you can say piles. Now next we'll talk about the treatment. Now what is the ultimate treatment for hemorrhoids or pile? So basically here we are talking about the homeopathic treatment for hemorrhoids and piles. Let's talk about it. So homeopathy offers an effective and the comprehensive treatment for piles or hemorrhoids that helps treat the condition and ease the symptoms. Homeopathic remedies for the hemorrhoids aim at correcting the internal disturbances of the venous system by making the vein valves stronger, which help in complete recovery. Homeopathic treatment of piles can help avoid invasive procedures like surgery. And once treated with homeopathy, piles does not recur. Under conditions where lifestyle modifications are sustained for long, the length of the homeopathic treatment for piles depends on the duration of the symptoms, their intensity, and how quickly a person responds to the medicines. And the treatment period can range from a week to a few months. Let's talk about the top 7 homeopathic medicines which has been successfully used for the treatment of piles, or you can say hemorrhoids. So first and the foremost medicine, as you can see here on the Aesculus hypocastinum. So let's talk about this medicine. So for the painful external non-bleeding pile, Aesculus is the best and the most frequently used medicine for the painful piles. It is taken when pain is felt during or after passing stool. The pain continues for long hours after the passing of stool. Pain is very sharp that may extend from the anus to the lower back. A person may have a distinct feeling of small sticks filling up the rectum. It is a specific medicine for the external piles and the blind piles, that is non-bleeding piles. This medicine does wonders on engorged hemorrhoidal veins, bring great relief in pain, and help in shrinking pile naturally. So if we talk about the doses that which potency can be used, so the most commonly recommended dose one may use is 30 Ch or 30 potency 2 or 3 times a day as per the intensity of the symptom. So for the piles with constipation and ineffective urge to pass stool, Nux vomica is the best medicine to treat piles with the constipation and ineffective urge to pass. So those who need this medicine have to go to pass stool several times in a day to completely clear the bowels. They pass stool bit by bit throughout the day and yet have the urge to pass the stool. They also have a marked pain and itching at the anus. Nux vomica is recommended for the piles that is non-bleeding, and for piles of the constipation triggered by alcohol intake, Nux vomica is the right medicine. It is also the best choice of medicine for the people with piles who lead a sedentary lifestyle. Now if we talk about the doses, so it can be used both in low to high potencies. So in the beginning, it is advised to take it in 30 potency twice or thrice a day. Let's talk about the third medicine for the pile, that is Eloscotrina. So for the protruding piles, Eloscotrina is ranked the number 1 medicine when it comes to treating protruding piles, that is internal piles taken outward whorls from the anus and can be seen as soft lump of tissues. The protruding piles are very sore and tender and look like a bunch of grapes, bluish in color. Person who require it may find cold applications on affected areas soothing and help during pain, soreness and tenderness. They may also have severe itching. Now if we talk about the doses, so it can be used in both low to high potency, and the most often prescribed dose is 30 potency. So it can be taken 3 or 4 times a day depending on the severity. Now let's talk about the fourth medicine, that is Hemamelis. So for the bleeding and the internal piles, this natural medicine Hemamelis work excellently. It controls bleeding piles in an outstanding manner. Hemamelis. Hemamelis is useful in cases where piles is internal, painless, and it bleeds. So painless, non-bleeding piles. These four words are an indication to describe the use of this medicine in its entirely, and it requires no further description. So if we talk about the doses, so what is the recommended dose? So in 30 potency, that is 3 to 4 times a day as per the intensity of the problem. Now let's talk about the fifth medicine, that is Collinsonia canadensis. So for the piles with the constipation, dry and the hard stool, Collinsonia is an effective medicine to treat piles with constipation when stool is dry and hard. It can be used when hemorrhoids are external or protruding and there is also marked pain. Additionally, a particular sensation of sand or stick in rectum may be felt. This medicine is also used to treat piles which is painful and with bleeding. Now if we talk about the doses, so it can be used in 30 potency twice or thrice a day. Okay, now let's talk about the sixth medicine, that is muriatic acid or acid muriaticum. So for the piles which are extremely painful to touch, muriatic acid is a leading homeopathic medicine to manage piles that is highly sensitive and painful even on the slightest touch. It is mainly indicated for the protruding piles. The piles look bluish or dark purple like a bunch of grapes. A characteristic feature is relief and soreness from warm application. Now, when and how to use muriatic acid. So let's talk about it. So it can be prescribed in a case of piles that are intensely painful. The most frequently used potency of this medicine is 30. Muriatic acid 30 should be taken once a day and in severe cases 2 times a day and not more than that. Okay, now let's talk about the last but not the least, that is Ratania. So for the piles with the intense burning sensation, Ratania is a medicine which is indicated to manage piles attended with severe burning sensation. Along with this, there is a marked straining to pass to. Piles may protrude out of the anus on straining for a stool. Apart from these, a peculiar sensation of a little pieces of broken glasses in rectum can be present. Pouring cold water over anus may provide relief for a while. Now, when and how to use Ratania. So for piles that have intense burning, Ratania is an ideal prescription. So Ratania can be used in low as well as in high potencies. So in the beginning, one may start with 30 potency twice or thrice a day, and after close observation of symptoms, higher potencies can be considered if need arises, and under a homeopathic physician's supervision. So this was all about the last medicine, that is Ratania. So these are the top 7 homeopathic medicines which has been successfully used for the treatment of piles, or you can say hemorrhoids. Now let's talk about some lifestyle changes which are very important to manage piles. Let's talk about it. So first and foremost, take high fiber foods like figs, flaxseed, beans, lentils, and fresh fruits and vegetables that help in a proper bowel movement. Secondly, consume a lot of fluids and stay hydrated, as dehydration leads to constipation and that can worsen the symptoms of piles. Next, sitting in warm water tub for 10 to 15 minutes can help relieve itching, burning, and aching. Next, exercise regularly. Last but not the least, reduce alcohol if you are a alcohol drinker, and stop taking caffeine intake. So these are some lifestyle changes which are very important and helpful in managing piles, or you can say hemorrhoids. So that's all for today. See you guys in our next video. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below, and yes, press the bell icon for more updates. Stay safe and stay healthy. And yes, thanks for watching this video.